Welcome to this episode of NLN, Podcast Nursing Edge Unscripted, the scholarship track. I am your host, Dr. Stephen Palazzo, a member of the editorial board of Nursing Education Perspectives. Nursing Edge Unscripted and our track entitled Scholarship celebrates the published work of select nurse scholars and educators from the NLN's official journal, Nursing Education Perspectives, and the NLN Nursing Edge blog. The conversations embrace the author's unique perspective on teaching learning innovations and the implications for nursing program development and enhancement. This episode is on the collaboration between the nurse faculty members and nurses in the clinical environment. We will discuss the author's article and national survey of collaboration between nurse faculty members and staff nurses in the clinical learning environment. The discussion will focus on the unique findings of the author who published the manuscript in the March-April 2022 issue of Nursing Education Perspectives. I would like to welcome our guest today, Dr. Katie Hooven, who is an associate professor in the Department of Nursing in the College of New Jersey in Ewing, New Jersey. Welcome, Dr. Hooven.
Thank you. Thank you for having me.
You're very welcome. Your article was very intriguing. I read it not too long ago and reread it before this podcast. And it's a perspective I've heard about, but not really read any research on, such as the one that you published, on that collaborative effort and the collaboration between nursing clinical faculty and nursing educators in the educational setting. And it was really kind of eye-opening, some of the perspectives that I saw and some of the findings that you had. And I was thinking this would be a great topic to share with the audience. So I have a few questions for you. And I just want to start by asking you to summarize your study and the themes that emerged.
Sure. So I have been a nurse for about 17 years, worked as a staff nurse, and then transitioned over to academia as a clinical site coordinator, so coordinating the clinical sites. And then I've been a full-time tenure track professor for the last 5 years. So I've always had a desire to look at clinical learning and the clinical education environment. And when I began my PhD in 2013, I really wanted to find some area in clinical education that wasn't covered. And I read a ton of information. And having had my previous positions of a staff nurse working with nursing students and a clinical coordinator trying to find the best units and really great sites for our students, I saw the struggle and I was trying to get a perspective from the literature from the students are our main stakeholders, and they are the reason why we do clinical education, right? And I read a ton of literature on their perspective, the students' perspective. And what I found was that they really value this relationship between their faculty member and the staff nurse. And then I started to look for literature involving the nursing faculty and the staff nurse. And we know that there's a huge gap, right? Academic practice gap. We know that most of our learning and our nursing schools are situated in institutions outside of the medical centers. So we have this kind of balance between students being seen as visitors and nursing faculty members that don't really understand or work within the entire organization. So a lot of times the student experience can suffer. So I really wanted to look at the perspectives of both the faculty members and the staff nurse as equals. So my study was, in my dissertation, I developed a tool called the Collaboration in the Clinical Learning Environment. Because when I was also looking at ways to kind of gather their perspective, I wasn't able to find a tool. I looked at every single clinical learning environment tool, and it was all for the students to fill out. So I developed a tool in my dissertation and validated that tool back in 2016. And then I distributed that tool and I got a really great response. About 880 people responded to my tool. Nursing faculty members were the largest group, about like 450, but I got over 320 staff nurses to respond to. And then about 100 people who worked in both sides. So they were an adjunct professor, but then they were a full-time staff nurse or some variation of having, their feet in both an academic institution and a clinical or medical center. So the study showed that there is obviously a lot of opportunity to improve the collaboration in the clinical learning environment. There was a lot of responses from both the faculty members and the staff nurses that showed they just weren't aligned with expectations from the students. And we know from the student perspective that they value the feedback from both the faculty member and the staff nurse. So looking at this study and doing all this research, I was able to see that there's still some major gaps in practice, but I thought publishing this in the Nursing Education Journal would be really helpful for faculty to see that perspective of their other counterpart and hopefully be able to kind of change some practices or even open some additional lines of communication to the staff nurses regarding clinical education and the needs of our nursing students.
Wonderful. Was there any overrepresentation of any specific region in the country, or was it pretty well distributed?
Actually, no. And I sent the survey out to all of the deans and assistant deans that I could find on NLN's website, AACN's website. I sent it to ASIN for the associate's degree program. And then I also went through, I can't tell you how many IRB boards for hospitals. I wanted to get the hospital systems like UNC in there, right? I wanted to get small rural hospitals. I actually did a map that showed I had pink, blue, and green. So nursing faculty were one color, staff nurses were the other color, and then the third color were the two different people. And I even had people as far as Puerto Rico respond to my survey. So a really nice distribution of academic medical centers, community rural hospitals, all across the country, which was really helpful. And before I actually kind of evaluated this survey, I looked to see if I had any kind of gaps or areas that weren't covered. And then I sent to additional people to kind of do the snowball to forward my survey. So I did have a well-represented sample, which I was really happy about. You know, males and females, I was right on par with what is consistent now, right? 10% of our nursing population is male, and I had about 9.8 male respondents. So I was really happy about that. Yeah.
Yeah, it'd be interesting to see if there were any regional differences or differences between the rural and the academic centers in their collaborative efforts. That would be something interesting to find out too. But I have to give you a lot of kudos, because it's very difficult to get engagement from surveys from not only nurse educators, but nursing administrators and then staff nurses especially. So in order to get that much of a response from both staff nurses and educators was really great. And I don't think there's another study that I'm aware of that looked at this particular question that had such a robust survey response. Yeah. Great work there. So talk a little bit about some of the themes that emerged from your survey, your data collection, and then what your take was on those findings.
So I guess we'll start with kind of my assumptions of what I thought I was going to find, right? Because we all have these ideas of, I really want to do the study and this is what I think. So I sent out a demographic portion of the survey too, because I thought that possibly there was going to be differences based on gender, age, or like primary preparation. So if, you know, a staff nurse had gone through a diploma program, or a nursing faculty member had gone through a diploma program, and historically the diploma programs, there was a lot more of a connect between the two. I thought that they would show higher levels of collaboration, knowing how important that was. I also looked at level of education. Obviously, I thought if there was a higher level of education on the staff nurse side, they might have report higher levels of collaboration. And actually, none of that stuff turned out to turn to be like, my assumptions were not correct, which is completely fine, right? I did a quantitative study, so there was little room for kind of my perspective. So I really enjoyed that because they kind of surprised me. And then the themes really emerged that showed that the faculty members and the staff nurses, so these were the ones that were like statistically significant, they were not on the same page with like goals and objectives from for the students. And I also had a portion that you could write some narrative, right? Give a little context to some of the answers in the survey. And a lot of staff nurses wrote that they had no idea what the students were there for, what what they needed to learn, what part of the program they were in. And they said they had been given like an academic syllabus, right? And we as educators know how important that is, right? That's like our contract with the student that shows we're meeting all of our objectives. Accreditation loves it, but it didn't really translate to clinical practice. Like, what are these students actually supposed to be doing? What have they done before? What can I do to help them? And a lot of the staff nurses said they really wanted to help the students. They just had no idea what level of help or what types of activities would be considered helpful. The staff nurses also mentioned this, incongruence of like their role in the student learning. So, maybe their job description didn't say that mentoring was part of it. Maybe they weren't even asked if they wanted to take on more of a role. They weren't asked for their feedback or their perspective. And so they felt like they were kind of just there taking care of patients. And, it was like, okay, here you have a student for the day. And so that I could see time after time would get, exhausting, or you feel like you're not valued. The nursing faculty members had a little bit more of a positive response to collaboration and actually scored higher as far as their perception of the collaboration that was happening versus the staff nurse's perception of the collaboration was happening. So they weren't on equal ground concerning a lot of the items in the survey. So for me, that shows that we still have a lot of work to be done. And a lot of this stuff is just communication, right? Like the line of communication, which I think is really hard to do. So they were kind of the major themes, like the staff nurses wanting to know a little bit more about the background of the nursing students, the nursing faculty maybe wanting a little bit more. They talked about wanting more communication, but not exactly knowing how to go about it. The faculty members wanted more consistent sites, right? Working on the same floors, which we all know, and I did the clinical site coordination for 5 years. That's very difficult, but bigger picture student outcomes, this is really important.
So what's your recommendations then, taking this information that you just presented from your data? Anecdotally, I certainly have seen this in my practice, of course, as an administrator for several years too. This is a common theme I hear about, this disconnect between what the nursing staff are doing with the students or think the students should be doing and the faculty, the clinical faculty. And you're right, maybe a robust kind of onboarding process for nursing staff led by nursing faculty that could talk about the objectives of the course and the things that we're expecting to see from the students' development during this time period. But also, I think it's important if we're working in a collaborative way, and I would like to hear your thoughts on this, is really eliciting our stakeholders, the communities we're working with, and their clinical faculty that are working and precepting our students on what they think the students practically need in those environments within the community, which may be a little different than we think they need based on the kind of traditional way we educate our students in the clinical environment.
Mm-hmm. Yeah, and when I also was kind of rolling out this study, another key part of information that I collected was if they worked on a dedicated education unit, and staff nurse on a DEU, or if they're a nursing faculty member on a DEU. And actually, I don't know the, how widespread the DEUs are anymore. I know it was a really push years ago. I haven't honestly heard much about them, and the facilities that we go to for the school that I work, we don't go to any DEUs. But I thought, maybe there's a big part of this. And I thought if they worked there, maybe they'd have a different perspective. But I think I only got like 1 or 2 people that even said that they were part of some type of a DEU.
Oh,
and
okay. So from all of those surveys, only 1 or 2 identified as being a DEU unit. Okay. Yeah, because I was going to say that'd be interesting if you had a large enough sample from your larger sample, a subsample of the DEUs, you could kind of break it out and see if there was any difference in the collaborative responses based on that. But
yeah, and you would assume there would, because the nursing staff on those units are supposed to have kind of a higher level of knowledge regarding nursing students and education, etc.
The institution, right.
Yeah, and I had thought at that time that there were a lot of DEUs, and I was hoping to kind of get that. perspective, but I really didn't get anyone that said that they worked in those type of units. And again, I'm not sure how prevalent they are right now, or even prior to COVID, having these units. But obviously my study would support these type of units, right? The staff nurses that are working and apply to those units would have an understanding that this is part of the role. And I also wanted to be very clear when I sent out my survey that, I understand the number one goal of the clinical setting is patient care. Right? That's the number one goal.
Right.
And so that needs to be the number one goal for everyone there, is quality patient care. And so, but I also wanted to make sure that there was a emphasis on student learning, right? So we can't all just say patient care 100%. There's got to be some way to kind of support that quality patient care with improving student learning. And those two objectives, I wanted to make sure, we know that they were never going to be completely equal, right? We're nurses, patients come first, but everyone also had to have that secondary goal of improving student learnings and improving outcomes.
And we should make it clear that your study was before the pandemic.
Yes.
And so the results, if you sent the survey out again, may of course be quite different. And that will lead me kind of to my segue into my next area I want to explore is, we were already doing simulation, of course, and when the studies came out about the validity of simulation and up to 50% could support our student learning in the clinical space, there was a move to start moving in that direction. And of course, the pandemic accelerated that move, and many states accepted 50%, some even more, and virtual simulation. So we saw a lot of simulation and even virtual simulation in the last couple of years. And there's talk about keeping some of it in place of the clinical experience. And it's a fairly contentious topic, I'm sure, and not the focus of your study. But what I wanted to ask about was how you would think or project some of your data, what it would look like in the world of now bringing in this like third variable of simulation and virtual simulation into this collaborative with dyad, now a triad, so to speak, and what your feelings around that.
Yeah, so when I started kind of diving into literature to find my little gap that I wanted to focus on in my dissertation, that was around 2013, 2014, 2015. So 2014, that large national study came out that promoted supported replacement of 50% of clinical hours with simulation, and it showed no difference on outcomes as far as like NCLEX pass rates, et cetera. But I still feel like, and at that point, and I still work as a registered nurse, that sociocultural part of clinical can and will never be replaced by simulation or simulated experiences. And so, I think that the pandemic has been really difficult. I know for my own students, because right now I'm teaching a leadership class, and one of their clinical experience was shadowing nurse leaders, right? And kind of being the nurse leader on a floor full of undergrads. And the pandemic has, cut our numbers, right? So although we could send 8 or 9 students with one clinical faculty member, now they're saying you can only send 5 to 6. So we've been prioritizing the undergraduates that need the traditional clinical experience, and the leadership students have not been able to go. And, on the same token with simulation and virtual experiences, while I do think the students are hitting those learning outcomes, and I think they're learning, right? The idea that they're going to be able to master and, practice every task and every procedure in the hospital setting is, not possible. So these, simulated experiences allow them to hit those learning objectives, allow them to have a little bit of experience, maybe in situations that aren't common. But what I think it is missing, and, even if schools have really great standardized patients, I think that just social context of trying to get through an assessment, but maybe having a family member walk in, or having a physician walk in and start asking you questions, or having the patient start asking you questions. I think the students need to be in those situations to really understand what nursing is, what nursing looks like. And honestly, with the pandemic, I think they need to be in those situations even more, right? you walk into a hospital unit now, it's completely different than, 3 years ago. And the sim labs look pretty much the same. So I also think because we're in a pandemic, that it's really important for them to continue to go to the clinical sites as much as possible to continue to kind of get this experience and give them a little bit of a heads up about what they're going to be walking into and, maybe hopefully smoothing that transition to practice. Because I think what I've learned from being an educator and having my PhD in nursing education is we can teach specific things as much as we want, but we need to teach these students how to learn, how to think, how to adapt, how to be flexible. And those are all things that I think the clinical learning environment just does every single time that they're there, more so than any other simulated experience or virtual opportunity. I think being there with patients, families, physicians, interdisciplinary team just allows for that more so than anything else.
Yes, Dr. Patricia Benner calls that salience and situated practice. She expands on that as far as students develop those skills only in situations in which they're being presented with, real world opportunities to think in action, think in practice, real time.
Yeah, I wonder what she would say about the simulation and the virtual experiences, because it's, I talk to my students about her theory, and I talk to them about, you can teach someone how to ride a bike, you can show them what to do, you can put your own foot on the pedal, but at some point you have to let the person get on the bike, pedal themselves, and balance. And that's what her theory is about, right, from those levels. So I'd be interested to see what her perspective would be of, the simulation and the virtual experiences on that,
Yeah. My understanding in speaking with her is that there's a place for it, and I think she supports it to an extent. But of course, it's just a part of the puzzle piece, right? One piece of the puzzle in this experience of the clinical know-how being part of a profession and having that salient kind of undescribable sometimes knowledge in action. Mm-hmm. So yeah, it's just interesting. So I guess the takeaway then from your study would be, and correct me if I don't interpret it correctly, is that there's collaboration happening. It seems to be a fairly collaborative environment, maybe more so than some think. There are some areas where there is improvement to be made, and that sounds like it's what the expectation is for the student in the clinical space, and is that congruent with what the clinical nurses feel a student in that particular space needs versus clinical educators and the objectives they write into a syllabus.
Mm-hmm. Yeah, and I think the staff nurses also just kind of something else that I read a lot is they just didn't feel valued, and they didn't feel like they were a necessary part of the educational process, which really hurt me to read, because being a staff nurse, I always knew I wanted to teach, right? So I had that innate just drive to help nursing students and to really learn, right, and take care of them and put them under my wing. But the staff nurses that have that desire to give just high quality patient care, and they are also willing to teach the next generation, a lot of them didn't feel like they were valued. They didn't feel like they were a needed part of the process, or that anyone had ever asked for their feedback before. And to tell you the truth, after me reading article after article after article, I had never seen their perspective. And I thought, this can't be. I tried every search term possible to figure out where these articles were hiding, and I could not find them. And I thought, wow, I remember being a nursing student. I remember looking up to the staff nurses and thinking, I want to be like them one day, or I want to emulate their behaviors, or you know what, I don't want to be like that. And I remember how valuable they had been to my experience to, maybe make or break a clinical rotation, want to go into that specialty, thinking about practicing how I was taught. And I just found it very alarming that I didn't see a lot more on their perspective. And it was nice for me to see how much of a response that I got from them, because it shows that they want to be involved, right? This was a study on clinical learning. They didn't say, oh, that's the faculty member's job. They were like, no, you know what? Right. I want my perspective known, and I'm going to complete this survey. And so the fact that I had over 300 and some nurses versus 400 and some for faculty members shows that both parties want to be involved in this, but maybe just don't know where to start or don't know how to move it forward.
Well, it seems like a very workable solution, right? It's communication, and we can all do that. We can figure out ways to communicate better with our clinical partners and find ways to include them in the conversation. We talk about being at the table as nurses. Well, this is a great opportunity to bring our partners in the clinical space to our table in academia and talk about the things that are really relevant to the students learning in the clinical practice and the communities that we're serving. So I want to thank you so much for, Oh, go ahead.
I was going to say even more
Finish your last thought.
With the pandemic and with staff nurses and nurses feeling burnt out and undervalued.
Oh, for sure.
I think it's just another push for us as educators to really, take a step further to make sure that we're including them in the process, that we acknowledge and verbalize how valuable their feedback is and how much we appreciate it. I think that's kind of one of those things that, we can all take from even this pandemic as educators. Yeah.
Right. Well, it was a pleasure having you here as a guest on our podcast, and I really appreciate it, Dr. Hooven, your time and expertise in providing us with the results of your study and some of the possible solutions going forward, and also bringing in a little twist there, talking about virtual simulation and kind of that dynamic that it brings into the relationship of the collaborative effort between clinical faculty and nursing educators. So, and to our listeners, if you've not had the opportunity to read Dr. Hooven's article in the March-April edition of Nursing Education Perspectives, and again, it's called A National Survey of Collaboration Between Nurse Faculty Members and Staff Nurses in the Clinical Learning Environment. And I want to thank our guests for joining us and thank all of you out there joining us in the podcast. And if you have any questions, please direct them to Dr. Hooven. I'm sure she'd be happy to answer them for you. Her contact information is still correct, I believe, on the published manuscript. So Thank you again, Dr. Hooven. Really appreciate it.
Thanks so much. Take care.